Hello, my name is Larry Baker. I'm a research professor in the Department of Bioproducts and Biosystems Engineering. I study water and water pollution, and more recently water policy issues. And part of this program, water-related training, education, research in the Global South, otherwise known as WATERS. And this is a third lecture in our module on the biophysical considerations for water resilience. Lecture number 3, the global situation for water and sanitation. This is a short lecture. I'm going to walk through kind of what the global situation is in regard to water and sanitation. And then that will lead into a little bit longer lecture, lecture number 4, which is methods to treat water and sewage in the Global South. I want to start with looking at some definitions the way the World Health Organization does. They often term things as unimproved and improved water sources. And I want to distinguish between that and safe water. It's a little bit different. So let's start with their definitions. Unimproved water would be an unprotected spring, so it's just bubbling out of the ground. A dug well with no protection. A cart with a small tank or drum. A tanker truck, surface water, or bottled water. Improved is piped water going into a dwelling, piped water into a yard or a plot, public tap, which is very, very common in many parts of the Global South, tube well or borehole, which is what in the United States we'd call a well as opposed to a dug well. A protected dug well, protected spring, or rainwater harvesting. So in some way these are improved to reduce the potential for contamination. And also to make the water more convenient so people don't have to haul it from streams and out of wells and things like that. So this would be a good example of a unimproved source of water. This is the river that flows through Ouagadougou, Burkina Faso. It is obviously very polluted. You wouldn't want to drink this, but many people do. This next slide, in the same, about a mile away from that, this is an improved source. You can see in the background here, there's a community water supply. This is a relatively modern water treatment and water supply system. The water is fairly safe, but you have to go here and haul it away. This young boy seems pretty happy about it, but other people maybe this is a bit of a chore to do. In Burkina Faso, many people have improved water supply, but very few people have, only about a quarter of people have water actually pumped into their houses. So still a lot of water hauling. So you can see where improved is the first step, but it's not the only step, of course. And in terms of improved water sources, most of North America, a good part of South America, almost all of Europe has improved water sources. Many parts of Africa and many parts of the Southeast Asia really don't. And in parts of Africa, it's even less than 50%. Now, on the downstream side, sanitation, human wastes are a very major potential source of disease. Any contact with sewage gives you the potential for acquiring disease, and then when you're sick, transmitting it. Piping sewage away from a residence is a first step toward improvement, but this often ends up in surface waters. You can see this is some houses along a kind of a gully in Cuernavaca, Mexico. Note the pipes here, a little hard to see in the picture, a little easier, here's a pipe coming down. These pipes are all kind of interconnected and coming down, and these are sewage pipes. They flush the toilet inside, and these go right down into the river, no treatment whatsoever. So anyone in contact with that water or drinking that water downstream is certainly exposed to any diarrheal diseases that might be present in the people in these houses. And this map has more reds and yellows than the previous map. We tend to do improved water first, particularly getting piping in and sanitation later. So you now see almost all of sub-Saharan Africa is in the has 50% to 75% or less than 50% adequate sanitation. So now with those basic facts, I want to start making the distinction between improved water and safe water. But let's start with the just the accomplishment that we have had so far. This is in improved water source, and these are piped. These are other improved, and you can see that this has had to increase from 1990 to 2000. To the point that we're right about the Millennial Development Goals at around almost 90%. Sanitation, that's considerably less. Improved is the darker green. Shared is the lighter green. But we're really not anywhere near the 75%. Really, we have 64% meeting the Millennial Development Goals. So the trend is upward in improvements. But now I wanted to distinguish between just improved and actually safe water. And to do that, I'm going to use a diagram that shows the relationship between, in terms of, shows the routes of fecal transmission. So I've used this figure before. I just noticed this. I hesitated for a moment. The citation is in one of the previous lectures. But here's human excretion. I want to just draw a couple pathways to illustrate a connection. It goes to waterborne sewage. That might go into surface water, and that might either go directly to humans or go through into drinking water and then to humans. And there may be some treatment here of some sort. From very simple to very complex. But in any event, we want to keep, we want to prevent the sewage from going into the river or soaking into wells as one step. And then we still want to be treating water. We probably always want to be treating water unless it's from a very, very protected source. And we think of this as multiple barriers. We want to protect the water sources. We want to treat the sewage. We want to treat the drinking water afterward in case there's any lapses along the way. And also there's animal contamination and that sort of thing that can affect drinking water too. So we need to do both. Actually, we need to do the whole system. We need clean food handling techniques. We need hand washing. We need isolation of or human excreta or at least decontamination, and then we need to decontaminate and clean the water. And all of those things have to be done. Now, the way we normally detect the safety of water, determine the safety of water, is by measuring fecal coliform. This is a measurement of bacterial contamination. It doesn't mean that the actual bacteria that they're measuring are doing the harm. In fact, they usually aren't. But if you have fecal coliform, if there's presence of fecal coliform, that means there's contamination from sewage, which means that if any one person has typhoid or cholera or anything else, then you've got a problem. So the normal metric that we're looking for is less than one one bacteria per 100 mils of water. This is a fairly simple measurement to do. Kits have been developed so people can do this at the household level. You need a little bit of electricity, but not much else. I've actually been part of a citizens program doing this. And you can see in the Western, in the developed world, virtually all water meets that standard. This is piped and otherwise improved. But then when you move to other parts of the world, even the piped water, this is the dark blue, the piped water usually meets the one count per 100 mil standard, but not always. The dashed blue lines are parts that don't meet that standard. So just because it's going through a pipe does not mean that it is necessarily safe. On the other hand, unimproved waters are typically not safe. They rarely meet that standard, or usually don't meet that standard. So here we have 6% and 10%. So an unimproved source is almost certainly not very safe, or very likely unsafe. So really the gold standard for water safety in terms of bacteria and such is really the coliform standard, which is pretty rigorous. Not just whether or not it's improved. Now, how serious is water contamination from bacteria and other pathogenic organisms in water? This is the best article I could find. This is current. It's death from diarrheal disease. That's different from just occurrence. Occurrence, people get diarrhea all the time and don't report it. But these diseases, some of these diseases, like cholera and typhoid, actually can kill you, particularly if you don't have medical care. If you have medical care, the death rate's in the 1% or less area. But if you don't, you can actually die, and for a disease like cholera, you actually die by dehydration. You have such serious diarrhea that you simply can't retain water, and if in some cases, many cases, you will actually die, even though it's a very, very treatable disease with a modern medical standard, and even with minimal medical standards. It's a matter of antibiotics and rehydration to save people. But this is a fairly rigorous epidemiological study on childhood mortality only. And children, usually for this kind of thing, it's the children, the very young and the very old, who are dying. People in between are a little bit more resilient. But worldwide, 800,000 deaths, and that is in the year 2010. I should point out that it's 11% of childhood mortality from all causes. And the annual decline, it's very good news. We're moving in the right direction, 4% less per year. That's a very good thing. Not such a good thing is that still in Africa, half of that is in Africa, a little bit more than half is in Africa. And that is a little bit higher percentage of childhood mortality. In the Americas, it's 11,000 deaths or so. And I should point out, not from a parochial standpoint, but just because the United States and Europe have had very good water treatment and sanitation systems. In the United States, the average number of deaths from waterborne disease from community water systems is 0. A typical year. I mean, there have been years when there have been deaths, but that's very, very unusual. And 0 really is the target. Not 0, I mean 0, none, is the target. So this is where ultimately one can get to, we hope. And then in the Eastern Mediterranean region, 123,000 of these, and then Southeast Asia. These don't exactly add up right because I think Oceania was in here, and I didn't want to make the table too big. But these are close. If you add these up, these are close to this. But the direction is correct, and the number is still very high. And again, with proper water treatment, proper sanitation, and good health care, when people do get these diseases, this can go down to 0. That should be the goal. In summary, development of improved water provision has increased more rapidly than sanitation, but both are improving. Improved water and sanitation does not mean it's free of pathogens. It's that coliform, that 1 count per 100 mils of water. It's that count that is the gold standard for pathogen safety. These sources of pathogens that cause diarrheal diseases are an interconnected system. It's food handling, it's hand washing, it's water treatment, and it's sanitation, sewage sanitation, either isolating or decontaminating sewage. It remains a major problem in the global south, these diseases. 800,000 kids in 2010, but fortunately it is moving in the right direction. Rates are decreasing by about 4% per year. Our next lecture will be, we'll talk about water and sewage at various scales and how to treat it.